Our specialty of basically interventional radiology is a field where we utilize basically cutting-edge technology to perform procedures that provide elegant solutions to problems that really have plagued man for a very long time, and to really pull all our instruments and devices out and put a band-aid down. I mean, that is really the goal of our field, to provide great applications of medical technology to make people's lives better without long inpatient hospital stays. My vision for the Lumen Laser Center is really quite different from really established ways to practice medicine. One in the fact that we are supplying very high-end technology to again treat patients in a very elegant, simple, safe, effective manner for varicose veins and other problems like that.
I was having trouble with my right leg. I'm very active, play a lot of tennis, and I'm a runner. I had a really bad vein that was very painful, was throbbing after most activity. I finally met with a friend of mine who's a nurse who works at Penn, and she suggested Dr. Kwak and said that he was one of the best physicians in the area to help with the vein that I had. So I met with him, I scheduled an appointment, met with him in his office, felt very comfortable after I met him. He explained the whole procedure, how long it would take, how long I would have to be off my feet, and I decided to schedule the procedure with him.
Hi, I'm Laura McGarry, and I'm here to tell you that if you have a problem with varicose veins, the next few minutes are going to make you feel a whole lot better about the solution. It's not surgery. It's minimally invasive. You're up and walking right away, and it's highly effective. In fact, you may start seeing improvement immediately, and it's dramatic. I'm talking about going from this to this in an outpatient setting with no downtime.
It's not an uncomfortable procedure. It went very smoothly, and it seems like you're in and out within an hour.
There was a minimal amount of time lost. You wouldn't be out of work that long. And the amount of discomfort seemed to be considerably less than the standard stripping technique.
You could speak with the doctor while it's being done and not feel anything, and get up and walk out the door.
It's all done with the same principle that powers this pointer, a laser. In its simplest form, a laser is a highly concentrated beam of light. Medical lasers work by delivering this light energy to the targeted tissue, and they're being used in all kinds of ways, from eye surgery to dermatology.
The laser is very safe. I've been using laser for over 10 years in my practice. The new precision laser by Angiodynamics for the use of ablating the saphenous vein, which is probably what you have in terms of your varicose veins, is really a safe, effective, proven method. And I really have been very happy with it. It's certainly better than the old procedure of ligation and stripping.
Now, prior treatments for varicose veins really have been surgical options, meaning that they knew that the certain vein in your leg was bad, that was causing the varicose veins. So really the surgical option was to go in there and basically take that entire vein out in a procedure called vein stripping. Now, vein stripping does not work 100% of the time, and also it's basically a large surgery where you have 5 to 6 weeks of downtime. It is painful, and the recovery is quite long. This is as opposed to the new endovenous laser ablation procedure that we are doing.
This established, proven laser technology is now being used for the treatment of varicose veins in something called the VenaCure laser vein treatment, which allows doctors to perform quick, simple, virtually pain-free procedures.
Varicose veins are basically veins in your legs that have too much pressure in them. The reason they have too much pressure is because sometimes the blood is not moving in the correct direction. Basically, veins were built to make the blood move up from your legs into your heart, basically going everything from south to north. The problem is that some people have that blood that's actually moving down their leg instead of up. That's called venous reflux. The reason that happens is because the veins are built with valves every several centimeters That valve really is supposed to catch the blood and prevent it from falling back down into your leg. If those valves go bad, that blood basically, instead of going north where it's supposed to back into your body, basically goes back south down into your leg. That causes increased pressure in your leg, and basically that ends up leaking out into your skin surface, causing the varicose veins.
This causes the bulging and twisting that results in painful, unsightly varicose veins. How does the laser fix this problem? Let's find out.
So basically the process would be you would come in, we would get you nice and comfortable, give you a small amount of numbing medication in the skin, go in with a small needle followed by a wire, followed by a catheter. Once we were inside the vein that basically was causing all the problems of your varicose veins, we would insert laser fiber, run it up through the segment that wasn't working well, and basically energize that fiber as we were pulling the fiber back. The entire procedure of actually lasering the inside of the vein that's not working well literally lasts in order of seconds, and maybe the entire thing may be over in about a minute, minute and a half. You do have to wear compression hose for about 2 weeks after the procedure, and that's really to help the treatment seal the vessel off. The compression hose are always going to be good for your health regardless of the procedure or not, because it basically makes your leg more efficient and work better.
There was no discomfort at all. I had to wear a special stocking for a week or so, but there was no bruising, no pain. Really, you wouldn't have known I had anything done.
I had no pain. I didn't have to take any pain medication.
You have no signs of the vein anymore. No signs at all. They're gone. And that is the best part.
It's 24 hours after my surgery. I feel very good. I had a good night's sleep. I'm not in any pain. I'm really thrilled with the procedure, and the outcome of it has been terrific. I'm very happy.
The veins that are closed off are superficial veins, which handle less than 5% of your blood flow and will not affect your general health in any way.
The vein that we are sealing off is part of this superficial system. In sort of a more simpler way to think of things, your leg basically has a major highway and a minor highway that takes blood outside of your leg. The veins that we are basically talking about in terms of varicosities, spiders, all those are superficial veins. They're part of really that minor highway system. In fact, by sealing off portions of your minor highway that are not acting well in terms of getting that blood back up into your body, we're actually increasing the efficiency of your leg.
That's it. The next thing you know, you're up and walking, resuming all normal activities and having much healthier looking legs to show for it.
You will have the procedure on day one. You will come back in 1 week for us to take a look, an ultrasound look at your leg, just to make sure the treatment worked and that your leg looks good. In 1 month from then, you will come back to us and we'll take a very extensive look at your leg. At that 1 month period, you should see some significant results from the fact that that leak source has really been stopped up at this point.
After the procedure, it took a couple of weeks. I think it was 2 weeks that I had to, before I could resume my activity. But as I said, I was a very active person, so it was just a couple of weeks. And once I went back for my checkup, he gave me the approval to start again, and I was immediately on the tennis court and running right after that. Absolutely, I would recommend the procedure to anyone having any trouble with their legs. It was perfect for me after.
So be assured, you don't have to live with varicose veins, and you don't need surgery to get rid of them.
Because of this new laser technology and other technologies like it, you can perform a lot of these procedures very safely, effectively, and better than traditional methods outside of the hospital. That's what really distinguishes Lumen Laser Center more than any other center out there, is that we have really the best that is currently available in medicine and technology to treat people in a very highly effective, safe manner, in a pleasant manner.